Is it more comfortable looking here?
Yeah.
The comfortable clothes, ready to go. Okay. So hi everyone, my name's Rabia. I know you can't recognise me with all this hair and makeup. I'm here with the lovely Dr. Zainab Aesthetics and Dr. Ahmed Smiles.
Hi.
You're also lovely, I forgot to add that, but he's also lovely, really, really lovely. So let's just get straight into it. Where did Dr. Zainab Aesthetics come from?
The name?
Yeah, the name.
Well, it literally just began as an Instagram page name. And it started off as Dr. Zainab, and then there was other Dr. Zainabs, and I just added a one. And then for years it was like that, and then I thought, right, majority of what I'm posting is all about aesthetics. So I just switched it. I just thought Dr. Zainab Aesthetics, and it's kind of worked, and I've stuck with it.
And yourself, you've recently started Instagram, so you're a newbie.
I'm a newbie.
Yeah.
I never thought I would be on social media because I'm quite shy. But I realised that this is what patients want to see. So got to a point where patients will call the practice and they will ask, well, can we see his work? And is he on Instagram? And so at that point I thought, okay, it's time for me to start Instagram and to show patients my work.
Okay. So you're shy, Zainab's definitely not shy. Yeah, I watch your Instagram stories every day. That's how we kind of met through Instagram, right? So I felt like I already knew you.
Yeah.
So how does your dynamic work? How did you guys meet? Tell me about you. A bit about your personal life.
Do you want to go?
I knew you'd put it on me. So how we met, oh, this is going way back, by the way. So we've been married now, it was 2005, it's like 14 years.
Oh wow.
And we were engaged for a year, so we're going back 15 years when we first met. So I hadn't even started dental school, and it was really not a time in my life that I thought I would pursue marriage whatsoever. It was all about studies. And Ahmed was in third year of dental school. But it was just a case of right person, maybe wrong time.
Yeah.
And you can't just choose the right time. So I thought, okay, I'll explore it. And then it just felt safe and felt right. And also because he was in dentistry, and I really wanted to pursue dentistry, and I had, started that ball rolling, I knew that him being a dentist was not going to hinder me, because if anything, he'll totally understand what I'm going to go through, he'll support it, he's in the profession, he'll get it. So we talked about that, and I could see that he was not, someone who's going to hold me back in any way. And so that was a non-worry, a non-issue for me then. And it just became, just easy really. Everything was just quite easy. Yeah. Well, maybe from my point of view, but Ahmed begs to differ, because it took a while before my dad agreed and all the rest of it.
Ooh,
but
exciting.
Yeah, and even I, being that young, you're just not ready for such a huge commitment. And I stretched out as much as I could.
Yeah, I mean, it was my final year.
Yeah.
So I don't know if you remember, in your third year,
you'd
get asked if you want to be on the interview panels.
Yes, I did do that.
Yeah, you did as well. Yeah. So like, there's a clinical, non-clinical, and there's like a student. Yeah. So I was a student, and then she came to apply for dentistry.
That's how you got in.
Well, funnily enough.
Cut that out. She actually got in because she's amazing, guys. Obviously, now all the patients going to be worried.
Yeah, funnily enough, I had seen him, so I had already heard through the grapevine that he was interested, but I hadn't really, I hadn't come of it, and I hadn't seen him or anything like that. But he was just turning up in places where I was. And
so you were stalking her?
Yeah. And then I'd come for the interview, and I saw, did I see before or after the interview? I think it was just after the interview, and I just thought, because he was going to do the tour guide thing, and then I was like, I can't do this today. Today's not the day, this is dentistry day for me, this is not the day I'm going to do this. So I left the tour, didn't go on the tour, I'm sorry.
Playing hard to get.
Yeah, you've got to do it. And then, and then from there, literally just lots of different encounters like that.
So you've got a daughter, Layla. How old is she now?
So she is 3 and 4 months now.
You've got another one on the way.
Another one on the way now.
Yeah. So how do you juggle that? How do you juggle being the boss? You're the boss of you two together, right? You own Hair and Hills Dental Beauty. Yeah. So how do you juggle being a principal, a wife, a dentist and all the roles that come with being a dentist and a mother?
The whole family planning thing and the whole motherhood thing, we waited 10 years. So we were married for 10 years before we had Layla. Because I was studying, so 5 years of dentistry, and then Ahmed was doing his masters, and I was doing lots of other training as well. And because we got married so young, we could wait, so we did. And so by the time it was planned, it was at a point where I really welcomed it.
Yeah.
So I took whatever came with motherhood, all the aches and pains of pregnancy and sleepless nights, and I really, really was on board with it because I'd waited so long and because I felt like I was now ready. So after 7 months, I started itching to come back to work, but she was too young to leave for too long. And this is the beauty of dentistry. You can do little snippets of work and do part-time. But I had this big worry about, well, who's going to look after her and am I going to manage this? And you know, all of that was building up, and I just started putting feelers out there about, you know, childminders and people, asking people. And I definitely didn't want her to go to nursery very young, and didn't take her until recently. So age of 3 she started nursery. So all that time it's been a really trusted nanny who comes to our house the times that I'm at work and then leaves when I come back. It felt like having another grandmother in the house. She's like a Mrs. Doubtfire figure. It's just amazing. So I was blessed and lucky to have that situation. It's not always, I think, that easy. And had it not been for her being that character, I would have just done normal 9 to 5 days. But I was here doing really long days. And I felt like I was at that stage in my career where I just felt really passionate about what I was doing, and I was building the practice, and I was really enjoying it, and it worked. But then the times that I was at home, I had to be totally present, because if I'm giving that much at work, then when I'm at home I have to give more,
Where do you bring that energy from to do that?
I have no idea.
And how do you deal with all the you must get so much judgment, right? For being at work. I know I've seen it on social media, like you get the own working mum guilt.
Yeah.
And then you're working so hard and you're doing your best, but judgment, there's always judgment. There's always those social media trolls, or those people that want to make you feel bad for working.
I can't say that I've had any. I've had some people say, where's your little one, or who's looking after your little one? Some mums who say, how do you manage, how do you cope? And I just say, let's be real, it's not easy. You know, it is a big juggle. Yeah. And when I go home, I have to give 150%. The day that the 3 days I'm off, I have to keep my phone away as much as possible and be present. More than anything, it's exhausting because then there's no break. It's work, and then that's another big role. So what gives is the me time. But I've slowly just tried to get a little bit of me time where I can. But ultimately, it's self-inflicted. It's a choice. I've made that choice. It's what I enjoy. So I can't really complain about it. Those are the things I find fulfilling, being a mum and being a dentist and giving what I give at work. So that's the choice that I've made. And I really have thought about, am I happy? Do I want to do this? And it always comes back down to, yeah, I'm actually really enjoying it. I don't mind being really tired doing this. But now with baby number 2, I think it came at a funny time because I was really in the swing of work. And I was at a stage where my friends were saying, Zainab, you need to slow down a bit, you know. We don't see you. Yeah, we don't see you, and you need to regain your social life, etc., etc. And I just kept trying to say, but I really enjoy what I'm doing and it's working for me, and etc. And I just try and fit in everything else and squeeze in evenings out. But this is something that now will force me to take a little break. I guess it's a blessing. It's just, I think, something that you need that sometimes. You need a bit of perspective. It's not all about work. And I really did want Layla to have a sibling as well, because she's so social. So this is really something that I'm really grateful for, and I hope it all works out. But yes, it's overwhelming because I've worked up until now. I'm 37 weeks now, pregnant.
I don't know how you're doing that.
Back pain. It just felt like I was again enjoying work and really committed. And in the middle of treatment plans, you can't just stop. It's just a commitment. That's the nature of our work, isn't it? The way I've managed the business side is I could not have done this on my own, for sure. Ahmed has played a huge part in the business aspect of things. So that's definitely a relief for me, and that reduces the burden, the fact that it's a partnership and that he can take things on Yeah, so I'm carrying this baby, so he's doing that.
You carry the business.
I carry the business as much as possible. So, you know, ideas and details, I'm quite a details person, I get involved with everything. But he takes a lot of that burden if there's a deadline with something or something needs to be done. You know, I know he's always got my back with that, and he's really super organized. So that's been brilliant.
So let's talk a little about teeth.
Yeah.
So this is a basic question. This is like an interview at school question. Why did you pick dentistry?
It was always between medicine and dentistry when I was like starting A-levels.
Okay.
So there's a few dentists in my family that usually helped. I ended up choosing dentistry because I wanted to focus on one particular aspect from an early stage and specialise into finishing dentistry and actually working on teeth as opposed to medicine. You don't really know what you're doing.
Yeah, it's very, very general, very broad.
Yeah. So yeah, I think I made the right decision.
Yeah, because you've got also a master's now as well, right? You did an MSc in UCL?
Yeah. So
why have you done that? Tell us a bit about that.
I graduated in 2006. I was working for a couple of years.
Yeah.
But I felt that I needed to do more so that I can take on some bigger cases.
Yeah.
I feel more confident. So this master's enabled me to take on these bigger cases, and it's definitely helped. It was challenging, because going from working in general practice for a couple of years and then suddenly going back to studying, exams,
Don't know if I could do that
deadlines.
again. Serious hair loss then.
Yeah. Taking a pay cut because financially you're not earning in practice and you're paying student fees. Juggling, just being very organised is what made it work for me.
Yeah. And you said you were in general practice for a while, so that NHS private mixed?
It was mixed.
Yeah.
Naturally, I started off doing a lot of NHS work, and then slowly I progressed. I mean, I've worked in the same practice for 11 years.
That's a long time.
Yeah.
Are you still there?
I'll be there for another 3 weeks.
Okay. Do you still do a bit of NHS there?
I do a small amount of NHS there.
Okay.
But because I've been there for a long time, I was able to change the way I do dentistry.
Yeah, practice your dentistry.
And but now when I'm going to be coming here, it'll be totally private.
Yeah. So what do you think about the future of NHS dentistry? Because a lot of students now are coming out, I'm sure they message you as well, they see the kind of amazing work that you do, and they all just want to go straight into being an aesthetic dentist, a Botox fillers dentist. They want to be that social media dentist. I've had DFT, so as you know, I've done DFT training a little bit, and they've said that this is what they want to do. They want to be that dentist.
I would say there is no rush into jumping into doing private dentistry. Most of the work that I've done, I had a lot of experience from doing NHS dentistry. Never try and compare yourself to others. You'll never be content and happy with what you do. Just focus on what you like to do. So if you like doing endo, then go and do some endo courses. Be very good at it. If it's cosmetic dentistry, do some composite courses. And then tell your story. Show your patient what you can do. Take loads of photos, and that way you'll start to build yourself. But there's no point trying to compare yourself to others, because it takes time, and you will be happy at the end.
Do you have the same thing to say or anything different to add? Because you probably get a lot of messages, don't you?
Yeah, a lot. And I would say to young dentists that the foundation is so important. And being really good at the basics is super important, because that's what you'll then build on. If you start becoming a perfectionist about doing the simple things like a scale and polish or a complex root canal or a tooth extraction, you will build this loyalty amongst your patients. They'll sense that. You're giving them the best care. You getting used to being in the habit of giving that becomes your standard. And when you build that loyalty, patients start to then ask for more from you. That's the point where you think, okay, what else can I give? If you rush into aesthetic dentistry or facial aesthetics, particularly if you leave dentistry and go to facial aesthetics, I've not done that, because for me, I think getting into dental school wasn't easy. Going through dental school was really tough. All the training thereafter in aesthetic dentistry, but not just aesthetic dentistry. Who knows whether you may leave all that foundation dentistry, go into advanced cosmetic dentistry and advanced facial aesthetics, and then you don't like it, or for whatever reason you decide that it doesn't work for you. You need to be able to always incorporate being able to do a good root canal, being able to do good fillings, all of that into a treatment plan. So you can't just in isolation jump onto big things. You need to be really good at everything, I think. If you want to be an all-round good dentist, those first, I'd say 2 to 3 years, just take your time and focus on all of that. In the meantime, you're working out what you're really passionate about, what you enjoy, and then slowly begin to pursue that. Once you've made a decision to pursue something, then immerse yourself in it and then master your craft. But I think that you need to just give yourself that chance to get good at everything first, so that you're an all-rounder.
There are some dentists out there that kind of turn their nose up at facial aesthetics. They say, it's not dentist's area of expertise and it's for the money, it should be teeth that you're dealing with. So what is your opinion on that?
My view is that dentists are actually really well placed to do it with the right training, in a nutshell. But I'll expand on that. So when I first started facial aesthetics, I didn't think I was going to go this far with it.
Yeah.
I just wanted to explore it. It sounded like an interesting course. I was just at that stage, about 3 years post-graduation, where I was just getting a little bit, things were getting a bit stale in general practice. And I just thought I'll just learn a new skill. But I didn't think that I would pursue it. And when I got into it, I really fell in love with it. And it just felt like an extension of the bit about dentistry I really loved, which is the creativity, the artistic side, sculpting teeth, just smile design. And this was just, okay, this is the next step, this is just the face. But it was using that same creative flair. I really enjoyed doing it. I just started seeing a few patients slowly, and each one, it was just really fulfilling. It was a nice little break from dentistry. And then patients would ask for more, so I went on different courses and thought I have to expand my skill, be able to treat the whole face, but I did it really gradually. So I don't believe that you should rush into it. I think really gradually master one bit, then go on to the next, master that part, go on to the next. And I think that because it doesn't come without risk, it's an area that I think dentists should not dabble in. If you're going to do it really well, and do it properly. So what I mean by that is, particularly with fillers, so with Botox the risks are much less sinister, and we're well skilled to use injections, we understand facial anatomy, we're trained and we know the muscles of the face, we get trained further and when we go to facial aesthetic courses. So I think Botox is relatively safe to do, but if you're going to do fillers, you shouldn't really dabble and you need to go far with it. So complications courses, further cadaver training, and really get to know anatomy to that next level. Although we're trained in head and neck anatomy at dental school, here you're learning more about the arterial supply of the face, the positions of the arteries, at what depth, etc. So cadaver training with the mindset of you're doing facial aesthetics is different from cadaver training at dental school. So you need to go on that. So as long as you are fully committed to doing it well, I think that dentists can do it super well, because we've already been trained to look at faces and look at smiles and look at teeth, that's all about art and aesthetics. You work in millimeters, you're already good at injections. By the time you've left dental school, you're already well into injecting, let alone an everyday working dentist. You're an injector already. So that confidence, I now train dentists and doctors for the last 5 years.
She's looking at me like I trained on your course, but I don't have her flair, so I didn't continue.
But when I noticed the difference in doctors and dentists, some anaesthetists are great. When I say great, I just mean that confidence at the beginning to hold the needle and inject someone. Absolutely. Dentists are very confident. And every dentist I've seen is thinking in a very artistic way, and the questions dentists ask are really relevant to what aesthetics is all about, which is producing nice results but safely, because we're already quite risk averse. So I'm not saying that we're necessarily better than doctors, but I think we are very well placed to do it. And I have no qualms about training dentists as long as they have that same ethic of being safe about it. And I think actually because dentists are generally quite cautious in their management of patients and quite cautious, you know, working in a small zone, I think that they're more likely to be quite meticulous with treatments.
Because patients come in with very high expectations, especially when you're dealing with their face. It's no longer the teeth, it's their nose. There's patients with body dysmorphia, and they're all coming to you to deal with their face. So how do you manage those expectations? How do you avoid those complaints? How do you handle their complaints?
So, as with everything in dentistry, managing expectations is the same with facial aesthetics, but at an even higher level. Particularly because sometimes people do have unrealistic expectations, or expectations of looking a certain way that you know you shouldn't even be striving to give. So speaking about it, having an hour-long consultation if it needs to be, when you first meet someone is important, not rushing it, not seeing it as a transaction or another treatment and that's it. It's really trying to educate your patients so that you're on the same wavelength before you pick up the syringe. That's all part of the consent process. So if a patient comes in saying, I would like to have my lips look like Angelina Jolie, and shows me a picture of it, I will sit there and assess that photo and say, okay, here are the nice features of Angelina, this is what's desirable, this is what's good about her lips, this is where you are, I love that, and I want to aim to achieve it, but we have to respect the anatomy of your lips. And sometimes you run the danger of overdoing it if you're trying to achieve a certain look. So let's respect the anatomy of your lips, let's try and produce something that's going to suit your face, your proportions, and I'll talk it through. And I've never had someone then not agree to follow my plan, because no one wants to look wrong.
So do you say no to people when they come in with, I want to look like this? So you actually say no, that you cannot have this?
Yeah, that's happened a number of times.
Good.
So at the end of the day, you want to sleep at night, you want to do someone a favour, not a disfavour. And if there's something that I think is not in their benefit, they don't need it and the risk outweighs the benefit, or already big enough lips and filling is going to be dangerous or cause complications or cause lumps or just look awful, it's a big no. Just very kindly explain that it's something that I don't think is going to benefit you, so I can't do that to you. More and more now, doctors are on board with let's create a natural look, whereas about 10 years ago they weren't talking about the natural look. It was just get fillers and Botox, bad press, not enough talk of natural looking, undetectable treatments. Whereas now the trend is let's create undetectable treatments, let's enhance someone, not change them too much. So more and more doctors are now in that mindset, so there are less and less bad cases. But the nature of the media is when there's a bad case, that's what's going to be in the papers. That's what's going to get talked about because it's interesting. But the majority of people who have good aesthetic treatments done are walking around and you've got no idea that they've got it done because it looks undetectable, and that's the way it should be.
So, I mean, in my case, I didn't jump into it straight away. I worked for 4 years. I saved up some money and I had a stable associate job, and I did it part-time. So I know you can do them full-time. If you can do that, that would be even better, but if you can't, then do it part-time. I was working 3 days a week and doing my MSc 2 days, and I was able to, to manage it. Try not to think about the money too much. Think about the return of investment in the future, because you could spend £10,000 on something, but if you're going to get £50,000 in return, that's a good investment. But it's not just about money, it's about job satisfaction, it's about the quality of your work, and definitely doing these postgrad courses will take you from this level to the work that you'll be more confident posting on social media. It will definitely help. Don't rush into it, and do it part-time, and that way you'll be able to manage it. So don't rush into it. A couple of years of dentistry, you'll be able to know what exactly you're good at, and then master it and be the best.
There is so much pressure when you first graduate, and I think especially as soon as you finish VT and people are in your group are talking about their next steps, and some people have decided they want to be specialists, endodontists, and some people want to go down the oral surgery path. And you're still thinking, I would just enjoy everything right now. But what's wrong with that? There's actually a bonus. You enjoy everything, you're lucky. So just do everything and be a general dentist. And then if you happen to fall in love with one part, go for it. But I would say don't just do an MSc just for the sake of getting the MSc. You have to love it because it is hard work. You know, like Ahmed said, financial hits and all the rest of it. But I think there's absolutely nothing wrong with being really good at everything, and then just seeing where that takes you. And that's what it was for me. So
Also try and jump out of your comfort zone as well, because being in that comfort zone is a dangerous place to be.
Yeah.
So always, you know, you could be working as an associate and earning very good money and enjoying what you do, but you're not going to progress if you don't come out of the comfort zone.
What was your worst day in dental school?
So my worst day, there wasn't many bad days other than, you know, as a dentist student, just really being very overworked. Especially in the heat of summer when everyone's off and only dental students are still there in mid-July, August, still working on the patients. But other than that, there was one incident that came to my mind. I had a needle stick injury. Yeah.
That's when you poke yourself with a needle that you've already used on a patient.
Yeah, and the patient was sedated. So normally after a needle stick injury, you'll have a chat with the patient, tell them what's happened, take a risk assessment, ask them how likely is it that you may have an infectious disease, etc., before you decide your next step. In his case, because he's sedated, we couldn't interview him or ask him anything. So, but what we did notice is he had some marks on his arms, so it indicated he might be a drug abuser. So of course I was really worried, so I went straight to occupational health and had the preventative antiviral drugs, which I took for a whole week. But they made me feel really sick. They do that. They make you feel sick sometimes. And I had my VT interview that week. So I remember sitting there in the interview just feeling really nauseous, already anxious about having an interview, but also because of these drugs. So yeah, I'd say that day was obviously not a fun day. But anyway, he after his sedation was all done with, he was spoken to. And we did take a sample from him. The hospital did take a sample, and he was absolutely clear. I had a blood test taken, it was all clear, everything was fine. But it's just that, experience as a dental student, that was probably, I'd say, maybe one of them.
I can tell you
Your worst one?
The dental school?
The dental school, yeah.
God, he really had that. He's like, I've got one.
I had it in my head, and I thought
it's got to be better than hers now.
Like, oh,
we're giving an award for this.
In my first year.
Yeah.
My end.
Yeah. Oh yes.
Yeah.
Oh, so he's a fellow Bart student.
Yeah.
Better than King's.
Yeah. So immature. We're like 18. Okay, and I was with my friend. Came out of a lecture theatre and coming down the stairs. He was like, Ahmed, slide down the stair rail, and I was like, he's like, go on, do it. I was like, okay, fine. So I go and do it, and I'm sliding down this stair rail, and then he shouts, stop. I'm like, what do you mean stop? So I just lost balance, I dropped, and then I look up, and who do I see? The dean standing there. The worst moment in my life.
Oh no!
Yeah, just looked down and just walked.
Just walked past.
Just past. Yeah.
Oh dear. That's actually like the worst thing that could happen.
Yeah.
I put that past needle stick. That's definitely like the worst thing.
And then did you see the scene around again?
Oh, every time I see him, I'll just
I just
walk the other way. Yeah.
Just turn around.
Yeah.
It's all good. All right. What about this video that you did with Shape Beauty? This one.
Yes.
What's that about? Give me a little bit about the context and
So
how it came
the
about.
context of this video is that Chef Beauty, at the time of her pregnancy, so she was pregnant, she went through hyperemesis, which is severe nausea and vomiting, and it was taking its toll on her teeth. She had lots of dental concerns, so she'd often send me messages asking me questions, and I'd happily answer all those questions. Suddenly, when I got pregnant, and she was pregnant at the same time, I just had a light bulb moment where I thought, you know what, all these questions I can answer in a video. How about we do this and it will help other women? So we decided to do that because I have so many patients who come in past the stage of pregnancy, so they've basically been neglecting their teeth during pregnancy.
Yeah.
And they come like when their kids have reached school age because they think now it's time to look after myself. They come in and by then, there's years of neglect, lots of problems, and they're saying it all happened when I was pregnant. you know, pregnancy ruined my teeth. And I think there's a bit of a myth that it's pregnancy that ruins your teeth, but actually it's the circumstances around pregnancy that make a woman not think of her teeth first and oral health. So I wanted to educate women. Actually, it's not the pregnancy per se. It's there are things you can do to combat these issues, and I wanted to reach a bigger platform so that it doesn't reach that stage where women are beyond the stage of repairing their teeth. And things are deteriorated so much that they have to fork out so much to repair things, etc. Lots of anxiety around that. So I just thought, you know what, knowledge is power, let women know a few things. And I thought, since Shepherd Beauty's got a really good platform, it'll be a good opportunity, and we're both pregnant at the time. I was going to, in that video, you know, highlight that we were both pregnant so it was relevant, but in the end, I didn't highlight my pregnancy at that stage. But she was very, very pregnant, like where I am now during this video. And at least that video is now there as a reference point for any woman who comes in and says, pregnancy's ruined my teeth. I say, could you watch that video? I'll talk briefly about it. I'll say, there's this video and I want you to please listen to it. So, so that was the nature of that.
There are dentists out there and people out there that think that dentists with a high following or high influences shouldn't really be on social media, or you know, they have a high following but their quality of work doesn't match up. What do you have to say about that?
I think it's really important to be authentic. So if what they're doing is not authentic and their followers are not real followers, and
that could be the case,
then you shouldn't be looking up to these people.
That's a good point.
That's a problem a lot of students do, don't they?
Yeah. There are a lot of pages out there with fake followers, and it surprises me a little that dentists will fall into that trap of being one of those pages. And of course, like Ahmed said, I think you nailed it. Literally work out who's authentic and who's not really.
Patient can tell.
Yeah.
They can tell if someone's work, I mean, you can tell by their work if they're good or not, but also if they're being, you know, genuine, because at the end of the day they will go see that dentist in their chair and they can tell if what they've seen on Instagram is what they can see here.
Real.
I think also it's important, I think, to maintain some integrity in our profession.
Absolutely.
And to have a sense of unity, and I like to think that dentists are out there to support other dentists as well, rather than tear them down.
Yeah.
And I think it's easy to look and think, oh, you know, so-and-so is only doing well because, and that's tearing them down.
Yes, absolutely.
And, you know, I think everyone should just focus on their own journey, try and be the best you can be, and contentment is really key. And when you start getting in that habit of tearing other people down, it's really important to look back inside and say, why do I feel the need to do that? And I think if we're in this profession where we are doing really, you know, really big work, changing lives, etc., high responsibility, high expectations, working with anxious patients and all the rest of it, it's quite heavy work.
Yeah.
So as professionals, I think we need to really invest in ourselves. Personal development is where I'm getting to. There is such a big gain to get out of investing in yourself as a person, not just professional courses all the time, not just dental course or facial aesthetic, but going out there and finding sources of inspiration, looking deep within yourself, becoming more patient, you know, learning how to be really present, managing your own stress, all of that, so that you're an all-round person and you're more likely to then think in a much more level-headed way, be very present with yourself and be more content and drive you away from comparing yourself to others. It just toughen you up, and I think that all dentists really need that.
Yeah, because I think not just dentists but people, social media sometimes is, you know, you see those posts, social media is bad for mental health, you know. So I think, is it because of the comparison, you think?
Yeah, and I get that. And I sometimes think about that, and I think before I post something, you know, as well, about young dentists, etc. And I have a post that I'm preparing to talk a bit more about the reality. And social media in itself is really time consuming. It's a job, it's not easy. It takes so much time. You've got to think about what you're writing. It takes time to put your before and after together. You're working in a busy clinic already, etc. And and you see other people posting all the time, you feel under pressure to keep up. But again, this is where it comes back to always think about your why. That's the bottom line for everything. Your why. Why do I want to be on social media? Why do I want to post this? Why do I want to be active? What is it for me? You know? For me, my page started as, it was actually, I think, one of the early dental pages that were showing composite bonding, for example. This is going 6 years ago. I remember searching a hashtag and I couldn't find any others, and I thought, how come I'm sure other dentists are doing loads of composite bonding. Why is it not a thing on social media? And then all of a sudden there was a big boom. And you know, I could have just got really caught up in it, and I could see that you can very easily get really caught up in it and just feel like you have to post every single day. But you really don't. As long as you are busy enough, as long as your message is already out there about who you are, what you do, your captions carry some value. It's not quantity, it's quality. So patients come in and sometimes will say, I came to you all the way because I saw your Instagram and I felt connected to it. And I thought, what's made them feel connected to it? Because surely it's just before and afters, just small snippets of me. But I look at my captions and I think, okay, maybe it's because I've explained this a bit more, or I've given a bit of insight, or put a bit of something emotive in there. So it takes effort to do that though. And I would say, rather than feeling like you're on a treadmill where you have to keep up with everyone, just make it, do you, make it really personal. So that matters and it makes a difference. And also, I think, you know, by the time I got into social media, I'd been a dentist for a good 4 years. So, and to be honest, social media did come later with a lot of this, what you're saying, you know, this sense of anxiety, and it comes with, you're always thinking, you're always comparing, you're seeing what everyone else is doing. But you've got to keep coming back to yourself, and that's where mindfulness comes in.
I like that, your why.
Yeah,
I think that's really good. The why. Why are you doing it?
Why?
Like, you have just joined social media, you didn't even want to be on it, so you're almost like pressured onto it. So you must probably understand the anxiety that goes with seeing people with a high following and being like, oh, that is...
I know, yeah, you just can't focus too much on other people. You just work on yourself. It can get stressful. You put a post in there and you're thinking, oh, I'm not getting enough likes. You know, people not liking my work. You know, why is it, you know, they're not commenting. So you get very conscious about what you do. I think now I just post and put my phone away. Do not check it for about a good few hours.
And also, for those who might feel the same, you might be surprised. People are watching, they can still see it. They might not press like because they don't want someone to see that they've liked it. They've registered it, they've absorbed it, they've saved it. And they still want to come and see you, or they want to ask you about it. They might send you an inquiry. They may not even be following you, but they're sending you an inquiry.
That's true.
And they didn't like it, but they have their own reason. So the likes actually really don't mean much at all. I would say just put quality content, do it when you can. Don't put pressure on yourself. Don't make it mean too much. Make it fun. And if it's starting to affect you too much, take a big step back. Don't let Instagram be on the first icon on your phone. Let it be on the last page. You're not always checking it. There's now there's a thing where you can check how long you've been on Instagram, like how many hours or how many minutes per day. Keep a track on that. You know, just make sure that you're not getting carried away. It is addictive. And there's so many studies out there that it does affect people's psychology. So if you just have to be mindful and just kind of keep it as a secondary thing and not as your main thing.
I like that. That was bloody amazing. That was really good. Like, I think that's going to really help a lot of people, and that's why I wanted to get out there. That was really good. What advice do you have to those dentists that find the profession so stressful? I know dentistry is one of those professions with the highest suicide rate. You know, dentists are leaving the job at a young age. Now, I love the job. I think people who follow me know that I'm a bit crazy at work, and I stay there till the cleaner's there. But there's other people who just can't. They can't hack it. Like, what advice do you have? How do you deal with the stress of litigation, the stress of patients, the stress of everything?
Yeah, and we were just talking about this in the car, weren't we? Just about what advice can we give to younger dentists who are under this kind of stress. And I think we've all been there. And even now there are some days, although the majority of the days we love and enjoy, there'll be the odd day that's really, really been a tough day and you're exhausted and you feel really stressed and you think, you know, and you just feel almost burnt out. What I would say is, again, before leaving dentistry, really dig deep onto what is it that's contributing to this stress. Is it the actual dentistry, you hate it, you don't enjoy it, or is it circumstantial? Is it the boss? Is it the practice? Is it the clientele? Is it that you just don't know how to manage your stress? Diagnose it, because if you just think I can't do this and leave, it could have been a big waste. It could have been the right decision.
Yeah.
But you have to go through that stage where you've at least looked into the why, what's going on here,
Absolutely.
and try to rectify it first and give yourself a chance. If you're in a really, really, a practice that's not supportive, you're being overbooked. That, I think one of the big stresses of dentistry is when you're overbooked. Because you can't give your patient everything. You've got patients feeling a bit annoyed all the time. And that's not pleasant. So you want to be in an environment that supports your work ethic.
Yeah.
And communication is really important. So you then need to talk about what your needs are in a nice way. Then comes diplomacy and talking in the, and all of that comes in, all your communication skills. If after that you've done that and you're still not getting anywhere, change your environment, change practices. So that's if it's circumstantial like that. The fear of litigation is the other thing you mentioned.
Yeah, it's a big one.
It's a big one. Record keeping. We all spend our evenings sitting behind making sure our records are up to scratch, that we've written everything down. And I think that there's no choice around that really. We've just all got to do that, and good record keeping is so important. But I think being a nice dentist, just being a nice person, even if that situation, we've all been told this in dental school, and I really believe it. Even if you've got someone who is really annoyed about waiting 20 minutes and wants to write you a complaint letter, the fact that they came in and you apologized and really were really attentive is going to diffuse that in the vast majority of cases, and you can turn someone's mood around.
Absolutely.
So you can prevent a lot just by being a really good, nice person, ultimately.
Sometimes it will happen to the patient you least expect it to happen.
Yes.
So you can't really prevent it. It's gonna happen.
Yeah, there's no one in your group.
You can reduce the risk by doing everything that Zainab said. If it's gonna happen, it's gonna happen, and just deal with it.
I don't know if you've been on that Facebook group. So there's a, what's it called, Dentists in Crisis, a mental health group for dentists.
Okay.
So there's dentists posting every single day, there's people posting on their behalf, anonymous, and it's things like, we're so stressed because of our bosses, our patients, we've got this complaint come through, and we did something just so basic and there's a complaint. So why do you think that's still there when people are apparently doing all the right things?
I think that there is this big culture out there now of no win, no fee. And people love the idea of suing dentists. Dentists are not the most popular professionals because of the history of how dentistry was maybe years ago, or they've had bad childhood experiences, whatever the case. Patients generally, you'll hear it, I don't like going to the dentist.
Absolutely.
So
everyone.
when something simple happens, some people unfortunately just want an excuse to give a dentist a hard time. Other times it's that they're genuinely really, their perception is they've had a bad experience. But we're lucky, we've still got our indemnities that draft us, good letters, communicate well with us. Just utilize all the support that we have. We've now got social media, Facebook group you just mentioned. We've got avenues to seek support. And I think if you stay really isolated, don't pick up the phone and ask for help, you will feel really down about something like that. But if you pick up the phone and get some help and get some guidance and vent it and talk it through and not be afraid to just deal with it openly and honestly, I think the majority of, especially with something basic and really done nothing wrong, you'll get through it. It's taxing, it's tiring, etc., but you'll get through it. And you've got to have, again, this comes back to mindfulness, positive thinking. But I know it sounds idealistic, of course it's stressful, it's horrible to feel like that. But there's always light at the end of the tunnel. Just seek support that's out there.
Yeah, no, I think you were saying about the phone call. I think there's a new a mental health helpline for dentists. I think it's called Denfluence or something. We'll research it and pop it in there. But there is one for dentists now. They started a couple of weeks ago, like a suicide helpline almost.
Really?
Yeah. For
that's
dentists.
actually
By dentists.
wow. That's really good. And burnout. So dentists, I think every dentist I've spoken to has reached that stage at some point in their career. Once you've gone through it once, you then start to recognize the signs when it's coming. So I remember a day, should I tell you one of my experiences?
Yeah, that would be really helpful.
So NHS practice, about 3 years into working at this practice, and it was coming up to the March period, so really intense, NHS contracts finishing, got to finish your EDAs. And I was working 6 days a week. And it was exhausting and really, really fast-paced. And I was ignoring signs of shoulder pain, just carrying on working because you have to. and long hours, etc. One day, I literally couldn't turn left or right. Yeah, just my trapezius muscle just trapped a nerve or something. It's just so much tension, so much inflammation. Just you're so exhausted. You're basically broken. You're not functioning anymore physically. And when you can't, and it's literally at that stage, it's like I have to take time off now because I can't function. I can't drive properly, and I have to take 3 days off. And the moral of that is, you're no good to anyone if you get to that stage because you suddenly got to stop functioning. So really being able to notice when you're about to become mentally burnt out and flag it up.
Yeah.
People do want you to maintain your function and be able to deliver what you do. So if you tell your receptionist, it's getting a bit too much, I need to space things out.
Yeah.
Tell your other half, I need support. Plan a holiday, whatever, but you've got to take action when you can see it coming.
Yeah.
Because if it gets to that stage, then you're going to need to take time off, or someone in the line of people that you deal with is going to experience you basically shutting down.
I kind of had a moment when I was 2 years out of dentistry and I felt like in the middle of a filling, my back went, and I was like, what was that? I actually physically had it, and my patient had it too. I was like, don't worry, it's just a suction. In my head I was like, oh God, I'm gonna die. It was horrible, and I had to give the rest of my patients the day to my boss. I couldn't stand, couldn't sit. It was the worst pain, and it's because we neglect ourselves.
Yeah.
This is where you need to add in, come see Hussain, my husband. That's why I don't have any back pain anymore.
Yeah, exactly.
But honestly, it is a really big thing, actually. It is a really big thing, burnout.
And then there's things like when you're reaching that stage, like you said, you just keep pushing through and keep pushing through, because the things that are going through your mind is, you go through your diary and you think, okay, if I clear anything this week, that person's root canal needs to be finished. That person's going on holiday and I've got to fit the crown. And it just adds up. Or, staff won't be happy if I cancel. Or I'm too booked ahead, my waiting list will grow.
Absolutely.
You think of all those limiting factors and you just think, I'll just get on with it. But we'll all get to that stage, and if we can just spot it, we are powerful. If we can just spot when it's really getting too much because we're no good to anyone, then we just have to stop. Like now, I'm at a stage where I've got patients who ideally I would have liked to still see for the next 2-3 weeks, but I'm being induced to give birth in 10 to 12 days, and I've not really given myself any time to process or plan this, or potentially there are days where I thought I could probably just deliver in this room, this is just non-ending. And
we have like a picture of a baby just flying out.
Honestly, I wouldn't put it past me. And I just thought, I have to communicate. I have to flag this up now. This is getting silly now. So I would tell patients, I'd ring them and I'd say, I'm in this position. I've had a change in my birth plan. It's not going to be 1st of August, it's going to be probably 2 weeks before. I've had to clear some days in my diary. I'm going to see you one more time, make sure things are where they should be, and then I'm putting measures in place for you to see so-and-so. And that so-and-so is Ahmed, thank God. and I totally have 100% trust that he's totally ethical, honest, super skilled, and he's going to talk to me about your progress, and I'm still going to be in the loop. But this is what I'm going to have to do. And if I've made that phone call myself and explained it, or if I've said it in the chair, face to face, they totally understand. But if I've left it to the receptionist to do, even though she does it as well as she can, sometimes patients don't get it. So sometimes I've had to just take that personal touch and explain it. The point is though, you've just got to do what you've got to do. When it comes to that stage where your health is first, you're no good to anybody when you're not well. You've got to still remember you're human. And there comes a point where life is important as well, but you still have to be really professional about it ultimately, and just make sure that you're maintaining continuity of care, and if you're going to take a break, then do it right. So
for the next Denfluence segment, who do you nominate? Which Denfluencers do you guys nominate?
I would nominate Teeth by Teki.
I'm going to hunt him down.
You're
Have
next.
I would probably nominate one of two people, or both. One is Dr. Sam Jethwa, and the other is Rona Skander, who is great with videos. Those two.
Okay, I'm coming for you guys. I like it. What's going to do?